Have you ever left a doctor's appointment feeling more confused, anxious, or even worse than before you went in? You thought you were doing the right thing, getting checked, staying proactive, following every recommendation. But what if some of those very tests that sound responsible could actually harm you more than help you after age 70? The truth is, modern medicine can sometimes cross the line between prevention and over-treatment. And while checkups are important, certain tests, when done too often or too late in life, can lead to stress, unnecessary procedures, or even real physical harm. Most seniors have no idea that the system designed to protect them can quietly put them at risk. But today, you're going to learn the 5 common medical checkups that experts say you should think twice about after 70. And what's smarter? Safer alternatives can keep you healthy without the hidden downsides. Let's start with a reality most doctors quietly admit. The older you get, the less your body benefits from aggressive screenings. Why? Because these tests are designed for detection, not necessarily for long-term comfort or quality of life. After 70, your immune response slows down, your healing takes longer, and your body becomes more sensitive to radiation, sedation, and stress hormones. That means a test that was harmless in your 50s might actually be risky in your 70s. Dr. Michael Hansen, a geriatric specialist from the Mayo Clinic, explains it like this. At a certain point, medical care should shift from chasing diseases to protecting comfort, clarity, and function. That's why more doctors are now emphasizing value-based care, testing only when it truly helps, not just because it's routine. So, let's count down from number 5 to number 1. The 5 checkups to be careful with after 70, what the science really says, and how to protect your health the smart way. And number 1 might surprise you because it's one of the most overused tests in the world. Coming in at number 5, the annual full-body scan. It sounds high-tech, futuristic, and reassuring, like you're catching everything early. But here's the catch. These scans expose your body to significant doses of radiation. A single full-body CT scan delivers about 1/200 times more radiation than a standard chest X-ray, and after 70, your cells don't repair radiation damage as efficiently as before. That means small doses accumulate faster, increasing your risk of future problems instead of preventing them. A 2021 study from the American College of Radiology found that seniors who underwent frequent, full-body scans had no measurable improvement in lifespan or cancer survival, but did experience higher rates of false positives and unnecessary biopsies. Positives are dangerous. They trigger anxiety, extra tests, and sometimes invasive surgeries for harmless findings, what doctors call incidentalomas. That's when the scan picks up tiny, harmless spots that look suspicious but mean nothing. One 76-year-old patient in the study had her kidney partially removed for what turned out to be scar tissue. So what's the smarter choice? Stick to targeted imaging only when you have clear symptoms. For example, if you feel persistent pain or new swelling in one specific area, your doctor can order a low-radiation MRI or ultrasound instead. Dr. Hansen says, after 70, scans should answer a question, not create one. Next, at number 4 is a big one, the routine colonoscopy. Now, colon cancer screening saves lives, up to a certain age. But after 70, and especially after 75, the balance between risk and benefit shifts dramatically. Here's why. The colon lining becomes thinner with age and sedation carries more risks, like low blood pressure, confusion, or slow recovery. A 2020 Johns Hopkins review found that for adults over 75 with no prior signs of colon cancer, the chances of finding a new, dangerous polyp were under 0.2%. But the chance of serious complications, like bleeding or perforation, was over 2%. That means the harm outweighs the potential help tenfold. Doctors now recommend what's called a stool-based test for older adults, a simple at-home kit that detects blood or DNA markers in your stool. It's non-invasive, requires no prep, and has over 90% accuracy for major cancers. You can do it once a year instead of enduring a full procedure. It's safer, calmer, and just as reliable for your stage of life. As Dr. Karen Liu, a geriatric gastroenterologist from Stanford, says, "The best test is the one that protects your comfort as much as your colon." Now, coming in at number 3, annual stress tests or heart imaging without symptoms. This is one of the most common traps for well-meaning seniors. You go in for your physical, your doctor suggests a treadmill test, maybe a CT calcium scan, just to check your heart, but unless you have chest pain, breathlessness, or a clear history of heart disease, these tests can cause more confusion than clarity. That's because they often detect harmless age-related changes, like calcium buildup or minor rhythm fluctuations, that lead to unnecessary procedures. A 2019 Cleveland Clinic study found that up to 45% of heart imaging referrals in seniors were unnecessary, and 22% of those led to unnecessary stent placements or medication changes. Why is that bad? Because interventions carry risk, especially in older adults. Sedation, bleeding, infection, and blood thinners can all complicate recovery. And here's the thing: your heart naturally changes as you age. A slightly slower rhythm or minor valve stiffness doesn't always need fixing. It needs monitoring and lifestyle support. Instead of stress tests, experts recommend regular blood pressure checks, walking tolerance assessments, and light activity tracking. Dr. Liu adds, "Movement is a better test of your heart than machines are." If you can walk briskly for 10 minutes without chest discomfort, your heart is doing its job beautifully. Now let's move to number 2, and this one shocks a lot of people. Bone density scans every year. You've probably heard that osteoporosis screenings are vital, and they are, up to a point. But after 70, doing them too often can actually lead to over-medication. A bone density scan, or DEXA, measures your bone strength. The problem is that bone density naturally declines with age. It's not always a sign of disease. Yet frequent scans often push doctors to prescribe bone-strengthening drugs like bisphosphonates too early or too long. A 2022 NIH report found that older adults on these medications for more than 5 years had a 70% higher risk of rare femur fractures, because the drugs made bones too rigid. Dr. Sarah Klein, an endocrinologist specializing in senior bone health, says, after 70, your bones need flexibility, not just density. She recommends repeating a bone scan only every 3 to 5 years unless you've had a recent fracture or drastic health change. In between, focus on natural bone nutrition: calcium from leafy greens and sesame seeds, magnesium from beans and oats, and daily balance exercises. Even gentle squats or heel raises can strengthen your bones better than any pill. The message is simple: fewer tests, more movement. Your bones thrive on pressure and nourishment, not numbers. And now, number 1, the most overused, anxiety-triggering, and potentially harmful checkup after 70, the routine PSA or prostate cancer screening for men, and mammogram for women with no symptoms. Let's talk about why this matters so deeply. These 2 screenings are heavily promoted, and for good reason when you're younger. But after 70, the science becomes murkier. For men, PSA levels often rise naturally with age due to harmless prostate enlargement. Yet a slightly high number can send you down a frightening road. More tests, biopsies, and sometimes surgeries that cause lasting side effects like incontinence or sexual dysfunction. A 2023 Harvard Medical Review concluded that for men over 70 without urinary symptoms, PSA testing rarely extends lifespan but often reduces quality of life through overtreatment. For women, it's a similar story with mammograms. After 75, breast tissue changes make mammograms harder to interpret. False positives become more common, and unnecessary biopsies increase. According to a 2020 study in the Annals of Internal Medicine, women over 75 who continued annual mammograms were 3 times more likely to undergo unnecessary surgery for benign findings. Dr. Elaine Kato, a leading oncologist in Tokyo, puts it gently. After 70, cancer is more often something you live with, not something you die from. The focus should shift to symptom awareness, noticing changes in your body, your skin, your energy, not chasing microscopic cells that might never grow. So what's the smarter approach? Personalized peace of mind medicine. That means shorter, calmer visits focused on how you feel, not just what machines find. Gentle physical exams, blood pressure, sleep, balance, digestion, the parts of health that actually affect your days. This is what geriatric medicine is moving toward. Quality, not quantity. But let's be clear. This isn't about avoiding doctors. It's about choosing smarter care. Your doctor should always explain why a test is being ordered, what it can realistically change, and what risks come with it. If the answer is just to check, ask, what will we do differently based on the result? That one question can save you from unnecessary fear and intervention. Now, let's talk briefly about why so many seniors still fall into over-testing. The system is built on prevention, which works great for younger bodies that bounce back quickly. But after 70, your body's goal changes. It's no longer about detecting every small issue. It's about maintaining stability, comfort, and joy. Your body is wiser now. It tells you what it needs through gentle signals. Stiffness, fatigue, appetite changes. Listen to those first before running for tests. Aging medicine in Japan has embraced this concept for years. They call it yasuragi care, peace medicine. Instead of endless screenings, doctors there emphasize morning movement, mindful eating, and companionship. And the results are astounding. Older Japanese adults report higher happiness and lower hospitalization rates than any Western country. As Dr. Kato says, we should measure wellness in smiles and steps, not scans. Imagine what this could mean for you. Fewer hospital visits, fewer anxious nights waiting for test results, more mornings where you stretch, breathe, and feel alive, instead of feeling like a patient trapped in an endless checklist. Real health after 70 is about autonomy, being in charge of your choices, not your fears. Here's a simple way to rethink your medical routine. Every time your doctor suggests a test, ask yourself 3 things. Does it target a real problem I'm feeling? Will the result change my treatment or just confirm I'm aging normally? And does the potential stress or risk outweigh the possible benefit? If you can't confidently say yes to all 3, it might be a test to skip. The truth is, the human body at 70 isn't fragile. It's adaptive. It's carried you through decades of stress, work, love, and life. But it needs gentle respect now, not more poking and prodding. As Dr. Hansen often tells his patients, after 70, the best medicine is less medicine, and more motion, more sunlight, more laughter. So, let's recap your smarter, not harder checkup strategy. Skip the full-body scans unless symptoms demand it. Replace colonoscopies with simple stool tests. Avoid unnecessary heart imaging. Let your endurance speak for itself. Get bone density scans less often, but strengthen your frame naturally with food and movement. And finally, rethink automatic cancer screenings after 70. Choose awareness over anxiety. Your body already knows what wellness feels like. It's calm mornings, steady steps, clear thoughts, and peaceful sleep. Tests can't measure that, only you can. And when you start trusting your body again, you'll find that health becomes simpler, gentler, and far more rewarding than any test result. Remember, your goal isn't to live forever. It's to live well. And that starts by protecting yourself not just from illness, but from unnecessary medicine. So, which of these 5 surprised you the most? Let me know in the comments below. And if you found this eye-opening, give this video a like, subscribe, and tap the bell. Because every week, we share science-backed ways to help you stay stronger, calmer, and more independent at any age. Your body is always trying to protect you. Sometimes, that means saying no to one more test and yes to more life.